That's me.
Good afternoon. Welcome to the Senate Finance Committee. Today is Thursday, April 4th, and we're going to start our meeting with concurrences.
The first concurrence on the list is Senate Bill 13. This is the bill that limits the authorized uses of the Pediatric Cancer Fund and establishes the Pediatric Cancer Research Commission. The House amendments address some ethics concerns related to the commission and therefore align the bill with House Bill 51, which passed the Senate unanimously. So motion to concur would align the two bills.
Second.
We have a motion and a second. All in favor of concurrence on Senate Bill 13? Everybody in favor? Thank you.
Next on the list is Senate Bill 220. This is the larger Department of Health, Public Health and Protections revisions bill that, among other things, aligns state law with federal law, prohibiting the sale of tobacco products to individuals under the age of 21, authorizes the Department of Health to reallocate certain cancer grant funds, et cetera. The House amendments just update the name of the governor's office tasked with certain duties. And so these are identical to the amendments that the Finance Committee applied to the House bill.
All in favor of concurrence on Senate Bill 220? Unanimous vote. Thank you.
Next is Senate Bill 594, which requires the Department of Health, in consultation with relevant stakeholders, to study the impact of requiring the Medicaid program to provide comprehensive coverage for the treatment of obesity. The House amendments do two things. It strikes the requirement that the department consult with specified stakeholders when conducting the required study, and it further strikes provisions requiring the department to specifically consider cost savings due to the reduction in the use of specified medications to treat specified conditions. The amendments retain the requirement that the Department of Health estimate any potential savings that may result from the requiring comprehensive coverage for the treatment of obesity generally. So it's sort of a balance.
Senator's not here. Is he in favor?
We don't know. Let's hold it till Senator Hershey gets here.
I rescind my.
Okay.
Next
Senate
is
Bill.
Senate Bill 944, which among other things, Senate Bill 944 repeals a prohibition under the criminal law article against selling or offering for sale a non-latex condom by means of a vending machine or other automatic device, while establishing a prohibition against the sale of a natural membrane condom under certain conditions under the Health General article. The House amendments exclude the bill's prohibition against the sale of a natural membrane condom from the penalty provisions under the Food, Drugs, and Cosmetics Act. This is the same amendment that the Finance Committee applied to the cross-file.
Move favorable.
Second. Second, Senator Ellis. All in favor of the concurrence on 944? Okay, unanimous vote. Thank you.
The next bill is Senate Bill 723. This is the bill that allows for testing of toxic metals in baby food. The House amendment adds the same definition that you added yesterday for standardization for priority labs. So if you concur here, you'll have the Senate bills and the House bills will be identical.
Motion to concur. Senator Ellis, second.
Second.
Senator Klassmeyer, all in favor of the concurrence on 723? Unanimous vote. Thank you.
Next bill is Senate Bill 1041. This is the bill, if you recall, that allows for the direct shipment of wine, beer, and liquor by manufacturers in the state to residents of the state. The House amendments are technical and correct cross references in the bill.
Motion to concur.
Move favorable.
Second.
All in favor of the concurrence on Senate Bill 1041? Thank you.
Senate Bill 1071. If you recall, this bill would require hospitals to establish and maintain protocols and capacity related to the treatment of patients who are being treated for opioid-related overdoses or conditions. You did the same thing to the House bill. There was a report that was struck and a change in effective date. So with these amendments to the Senate bill, the House and Senate bills would be identical.
Move favorable.
Second.
All in favor of the
Concurrence on Senate Bill 1071. Unanimous vote. Thank you.
Finally, on the first page of the blue sheet, this is the Attorney General's bill that deals with outpatient facility fees. The Senate amended the bill. The bill as it was introduced, changed some definitions to expand the application of facility fees in hospital areas. You all struck all that and just went with a study that was worked on with the Attorney General and Health Services Cost Review Commission. The House redid that study, redid the language of that study that the Health Services Cost Review Commission would do with relevant stakeholders. And with regard to the expansion of facility fees in other areas of the hospital, they have a additional work group established to study that issue also.
Motion to concur.
So moved.
Senator Ellis and Senator Kramer. Thank you. All in favor of concurrence on Senate Bill 1103. Thank you.
That's it. Something else.
So the next bill on the concurrence list on the next page, Senate Bill 70. This is the bill that requires the Maryland Transit Administration, before announcing any service reduction or cancellation of an existing bus route or line, to compile a report on the impacts of the proposed change. The House amendments relocate the requirements of the bill without any substantive change to an existing section of law that specifies procedures for major transit service changes. So there's really no, it's essentially a technical amendment.
Senator Kramer and Senator Ellis. All in favor of the concurrence on Senate Bill 70. Motion unanimous. Thank you.
Okay. Senate Bill 230, this requires the insurance commissioner to allow a business entity that meets a definition of a small employer to be represented by certain individuals other than an attorney at a hearing held by the commissioner. The House amendment just makes a technical correction.
Senator Kramer and
Second.
Senator Ellis. All in favor? Unanimous vote. Thank you.
Senate Bill 231, this is the Insurance Administration's departmental that establishes limitations on solicitation by public adjusters and other consumer protections. The House amendments, among other changes, establish a contract rescission period of 15 business days instead of 10 business days, which this committee adopted and amended onto the House bill. So I think to stick with the position of the committee on how that should be done, the motion would be to not concur.
Move not to concur. Second.
Okay. Thank you. Not to concur. Thank you.
Senate Bill 245. This bill extends the termination date for the Maryland Community Health Resources Commission. The House amendment extends the termination date by 10 years instead of 3.
So we had it as 3, right? We did
Well,
with the,
The bill the bill is introduced had it at 3. So
What the department kept saying.
we
Three.
did all of them 3. So we had a motion not to concur. Was that Senator Reedy? Who wants the second? Senator Mounts? Reedy, Mounts. Okay, all in favor of the not to concur? Unanimous
Just
vote.
don't wanna lose the commission, huh?
We won't lose it. Okay, Senator,
Senate Bill 595. This is a bill that requires an administrator, carrier, a pharmacy benefit manager, when calculating an enrollees or beneficiaries contribution to an applicable cost sharing requirement under a health plan to include any payments made by or on behalf of the enrollee or beneficiary, such as through a copay assistance program. The House amendments are pretty substantial. They, among other changes, do not apply the bill requirements to the deductible under a high deductible health plan. They require a person that provides copay assistance to notify the enrollee or insured of the maximum amount and expiration date of the copay assistance and make a violation of the notice requirement a violation of the Consumer Protection Act. That's in addition to just generally a wholesale reworking of the bill.
Senator Hershey.
Madam Chair, yeah, essentially the House gutted the entire bill and took all the recommendations of the insurance companies and passed what they wanted. We had a bill that was much more in favor of the patient advocates. And I would suggest that we continue to represent the patients and try to drive down drug costs and not necessarily listen to the industry. So I would say we do not concur.
The second for the not,
Second.
Senator Reedy. All in favor of the not to concur? Thank you.
Last one is Senate Bill 781. This alters and establishes requirements and prohibitions relating to health insurance utilization review and prior authorization. The House amendment alters a protection relating to prescription drugs and reauthorization so that it includes an immune globulin as defined under certain federal regulations, and it also strikes a provision that exempts a provider employed by a group model HMO from this protection under the bill. These changes are the same as the changes that this committee made to the House crossfile.
All right.
Second, Senator Ellis was the second. All in favor of the concurrence on Senate Bill 791? Okay,
Thank you all.
thank you. Let's go back to the one we waited for Senator Hershey to be here. It was Nathan on Senate Bill 594. We held it for you, Senator Hershey. Mhm.
Would you like me to summarize it again, or you?
If you've already summarized it, I can just explain it again. Madam Chair, I thought we put together a very good and comprehensive request to do a study on this bill. Unfortunately, the Department of Health came back with a fiscal note that said that this simple study that was going to be done by the end of the year was going to cost $250,000. So the House let me know that they could not pass a bill that had that type of fiscal note on it. Whether it was accurate or not, I don't think we debated that too much, but my impression was it was not accurate. But we did scale it down a little bit. Unfortunately, we took out some of the groups that I thought could help us out with really, getting to a better idea on the effectiveness of not just the anti-obesity drugs themselves, but what type of cost savings other states are seeing as a result of the comorbidities and trying to decline those. At the end of the day, I think, if that's the concern of the House, that they have to manage the fiscal note on it, then I would just suggest we concur and we'll get something out of this, which is appreciated.
The House has a $100,000 limit. Anything over
That's
100.
what
Yeah.
I was told.
Yeah.
Yes.
So,
Thanks.
so motion to concur on Senate Bill 594. Do I have a second? Second is Senator Ellis. All in favor of the motion to concur? Reluctantly, thank you. And now we're gonna go to.
Mhm.
And we're gonna start with.
Patrick.
We're gonna start with Patrick and House Bill 482, which Patrick has totally reworked the bill for us in the last 24 hours. He got all the good bills this year.
Yeah, so this is the bill that increases the uninsured motorist penalty that applies when required security or insurance on a motor vehicle registered in the state terminates or otherwise lapses during its registration period. The bill also increases the portion of the uninsured motorist penalties that accrues to the Maryland Automobile Insurance Fund, the uninsured division, beginning.
Patrick, I need to interrupt you just a minute. Do we have a reprint?
There should be a reprint in front of you.
Is it
1482.
1482?
Yeah.
Okay, I'm sorry. Go ahead.
Yeah, so the reprint is got a lot in here because what the amendments represent is bringing in elements of Senate Bill 1081, which is a bill of Senator McRae's that was in Triple E. And so I'll just walk you through it. What's brought into the bill are provisions that establish a driver education in public high schools grant program under the Maryland State Department of Education. And the purpose of this program is to provide grants to public high schools and nonprofit organizations to assist schools in offering driver education courses for students. There's these grant programs, they have to prioritize schools with students, the schools that have at least 40% of the registered students eligible for federal free or reduced price meal program, and nonprofit organizations working to offer a driver's education course in a school, which at least 40% of the students are eligible for free or reduced price meals. The bill establishes a fund for the grant program, and the connection to this bill is that a portion of the monies received from the uninsured motorist penalties would go to this grant program. I think it's $2 million for this one. There's an additional grant program established. It's the State Aided Institutions Field Trip Grant Program in MSDE. And the purpose of this grant program is to provide grants to public schools to provide transportation to students for field trips to educational institutions that are qualified as state aided educational institutions. And I think this is a program where grants go to schools that can take students to places like the art museums and other participating nonprofits where they have educational programs. So this program also would receive some funding from the uninsured motorist penalties, and I think the amount is $600,000, which is specified later on. The amendments, they keep on page 3 of 6, these amendments retain as introduced the increase in the penalty from $150 to $200, but it strikes the change, it keeps in place the per day escalating penalty as it is under current law, which is $7 for each day once you've been lapsed for 31 days or more. And then on page 4 of 6, you can see here that the allocations are changed to distribute $2 million to the driver education in public schools fund and $600 to the state aided institutions field trip fund. Nothing would change under the bill regarding how much money goes to the uninsured division for MAIF. So they would still get the increased funding for the uninsured division as is laid out in the fiscal note. So what would really change is what's left over for the general fund, since there's going to be less money, or there's more money is going to be diverted to these grant programs. And I think, don't have an estimate on this, but with the with keeping in place the $7 per day fee, that would mean that there would be less revenue coming in from the fee increases, but we don't have an exact estimate on how much that would reduce the amount going to the general fund. So those are the amendments.
Thank you, Patrick. Does any
Favorable.
Senator Reedy, are you seconding?
I actually have a question.
Okay, can you second and then we'll ask a question?
I'm not sure I want a second.
Okay, Senator Ellis, thank you.
I mean, I might, but on it.
That's okay, we got it. Go ahead, ask your question.
So explain to me what this bill does. I'm kidding, but what this is raising fines on, is this raising the fine if you've had your insurance lapse?
That's right.
And how much is it raising from what to what? I was trying to find it.
150 to 200 for the first 30 days.
And then it's $7 a day afterwards?
Yeah.
Which is
the current law. Yeah.
And it's taking the increase and putting it into other funds, or it's taking a piece of the increase and putting it into this program to take kids to art museums?
Yeah, so these funds are allocated under a formula. I think like 30% of the funds from uninsured motorist penalties under current law goes to MVA, and then the remainder goes to certain recipients that are laid out in statute.
Already laid out in statute.
Yeah, you can see that on page 4 of 6. So like a certain amount goes to the Safe Schools Fund, $2 million goes to the Vehicle Theft Prevention Fund. But what the bill does is it is increasing the amount that MAPE is getting under this allocation, so that they get an additional $3 million from this pot of money that can go to the that can go to support the uninsured motorist division of MAPE. And then in addition, with these amendments being brought in, we've got two additional recipients, of these revenues from the uninsured motorist penalties, and that would be this grant program for driver education and this grant program for state aided institutions, the field trip program.
So that's totally new. So
That's
we're-
new.
We're raising a
Yes.
fee, which, is people, not a fee, I mean, it's a fine for having your insurance lapse. How do the fines for your insurance lapsing in this situation compare to the fines for if your insurance lapses in private insurance? Is the same amount of money? Okay,
It's your insurance lapsing. It's not anything about what company it's with or whether it's with MAPE. It's just, this is what it costs you when you lose the insurance on your vehicle.
well, it's for everybody.
Yeah, it's for everybody. So the first day to the 30th day is $200, 30 days. Then after that, it's $7 a day.
And, okay. But it was 150, so we're going to 200.
Right. And the testimony from folks who came in said these fees have not been changed since 1991. So,
Right.
One, they're looking for additional revenue to support, these purposes, but also it's to enhance the deterrent effect of driving without.
And I know it's important for MAPE to be well funded, of course. I do kind of question.
Senator, if I can correct something, this isn't to fund MAPE. This is to fund the victims that have no uninsured motorists. So you're walking down, you don't have insurance, you're walking down the street, you get hit by a car that also doesn't have insurance. You don't have a car policy to go back and get
Right.
PIP or anything. So that's what this funding is for the victims that are hit by uninsured motorists that also do not have insurance. It's not funding MAPE, it's funding the uninsured motorists for victims.
Thank you for that clarification. That's an important fund, although, so if you're uninsured, like hitting another car and uninsured, or if there's any kind of accident with a car and it's an uninsured motorist and you don't have insurance, this covers you. But we're also, so that I have no objection to that fund being well funded, of course. I'm kind of curious about, I have nothing against field trips or is this a new program, driver education in
It's
public
a
schools?
new grant program. Yeah. So the bill would be establishing a new grant program for that, and also for driver's education, and also for the field trips.
I would feel better if this didn't include new programs. Not that I'm against either one of those things necessarily, but okay, thank you.
Mention that there were two bills that came to us. This is a House bill. We didn't have a cross file. Senator McCray had a separate bill to do similar, the fees were a little higher. But that's where the idea came for the buses and the was it the
Driver's
buses
ed.
and the driver's ed? So we kind of merged the two bills. Thank you.
Thank you, Madam Chair. Just, you mentioned that there's a penalty for the first 30 days, correct? Okay. And how quickly is it that the insurance companies notify MBA when you don't make a payment? Do you know?
I think it's at the end of the grace period. So most policies, I think they have to have a 20-day grace period. So you don't pay your insurance on the 1st of April. By April 20th, it has now totally lapsed. And
Right.
then the electronic notification goes to the motor vehicles.
So then they contact motor vehicles and motor vehicles.
It's pretty quick, actually.
Yeah. Okay. Okay, thank you.
Had a motion and a second. All in favor of House Bill 1482? Let's call the roll.
House Bill 1482 favorable with amendment, Vice Chair Klausmeier.
Yes.
Yes. Senator Kramer. Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mounts. No. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey?
No.
No. Madam Chair?
Yes.
Yes.
7-3, the bill passes. Okay, next we have a local bill, Senate Bill 1184.
Going down your list, Senate Bill 1184 is a local bill that authorizes the Prince George's County Board of Licensed Commissioners to issue a Class B college athletic event venue concessionaire beer, wine, and liquor license for use by a concessionaire contracted to provide food and beverages services in a designated area of venues that are located on the University of Maryland College Park campus. This is basically for the Xfinity Center, as was brought to us by the university. There's an amendment offered by the Prince George's County Senators. It adds Bowie State to the locations that may be eligible for a license. So you have the amendment from the senators, and you also have a letter from the senators supporting the bill as amended.
Second.
Thank you. That was Senator Washington and Senator Reedy. All in favor of Senate Bill 1184, this nice local bill? Unanimous vote. Thank you.
The next one is another Prince George's County alcohol bill. This is from the House. It's House Bill 816. It's similar to Senate Bill 51, which passed the Senate. The bill as amended is a local bill that authorizes the Prince George's County Board of Licensed Commissioners to extend a deadline by which a license holder must file a renewal subject to conditions. The bill also specifies that the license or permit that was subject to renewal and was not renewed must be considered unexpired until July 1, 2025. There are three amendments offered by the Prince George's senators. You have those in a reprint. The first is technical. The second one conforms sections of the bill to Senate Bill 51. And rather than codifying the extension, the deadline extension, it uncodifies the deadline extension subject to conditions. You have a letter from the Prince George's County Senator supporting the bill as amended.
Motion
Move favorable.
and a second. Senator Washington, all in favor of House Bill 816? Unanimous vote. Thank you.
Okay, House Bill 1388, you have a reprint in front of you. After some of the discussion yesterday on this bill, the chair has worked on some amendments, additional amendments to the bill. I think you're all aware of what it does. It provides that as introduced, that any employee licensed under the health occupations article or licensed under or veterinarian licensed under the agriculture article would not be subject to non-compete provisions in their employment contract if they had one. So if you go to page 2, there's been a slight change to what you saw yesterday. Initially, there was questions about clinical services, so we can go straight through the first element of the non-compete prohibition. So it would be for employment in a position which the employee is required to be licensed under the health occupations article, is employed in a position that provides direct patient care. And you'll see that there's new language here subject to paragraph 3, earns equal or less than $350,000, not 300, but $350,000 in total annual compensation. There is no change to the exclusion or the exclusion for the veterinary practitioners or veterinary technicians. The subject to paragraph 3, if you go down to below line 14, you'll see that the $350,000 would be subject to the consumer price index. So for the 12-month period beginning January 1st, 2027, if the commissioner determines that there is a change in the consumer price index, they could increase that base salary consistent with the consumer price index. They would have to post that information on their webpage. Going down further, generally the bill prohibits non-competes for the circumstances you just heard. However, it does authorize non-competes under certain conditions. So again, if you're for employment in a position in which the employee is required to be licensed under the health occupations article, employed in a position that provides direct patient care, there may be a non-compete or conflict of interest provision in a contract. And again, it's subject to the consumer price index changes, if any. may apply if the employee earns greater than $350,000 in total annual compensation. Go to the next page. And may not exceed 1 year from the last day of employment and 10 miles in geographic restriction, and this is another change, from the primary place of employment. Also, there was language added that said that the employer of the employee had to provide information to patients of the new location where the former employee will be practicing. This is slightly adjusted to say upon request of a patient, the employer shall provide notification to a patient of the new location where the former employee will be practicing. There was also a study required in the bill. There's been slight adjustments to the study. The Maryland Healthcare Commission shall contract with a private consultant in consultation with relevant stakeholders to study the effect of private equity firms on healthcare market, the impact of the state's ability to meet the goals and objectives of the total cost of care waiver, and the impact of efforts to address disparities and social determinants. So these two items be directly related to the effect of private equity firms on healthcare market in the state. Next, there would be additional elements, a payer mix for physician practices and groups with private equity ownership, the impact of hospital consolidations on physician practices and the acquisition of physician practices, and the impact on nonprofit hospitals and health systems' ability to maintain access to care, including the ability to hire and retain physicians. So items 2, 3, 4, and 5 are directly related to physician practices. All else in the bill is the same as it was yesterday. So this would apply to employment contracts or similar documents for the healthcare professionals detailed in the bill on agreements executed on or after July 1st, 2025.
I guess, or just a thought. I mean, it's like we have two different bills here, basically. One is kind of like what's going on, or that's what we want them to do. But in the meantime, we're asking for the study before we know what they should be doing. Does that make sense?
I think the purpose of the study is to see if we're going to totally eliminate non-compete. So what we did in this bill was restricted to people earning more than 350,000 are still subject to non-compete. But after the study, maybe the decision will be we just eliminate it completely or not.
Okay.
And to be clear, the veterinarians, the non-compete would take effect on the effective date of the bill. So for them, the prohibition on non-competes in their contract would begin on June 1, 2024.
Yes. Senator Ellis?
Yeah, quick question. So David, existing non-compete contracts, what will happen to those, if anything?
This bill would only apply to contracts executed on or after July 1, 2025. So any existing non-compete could still be enforced.
For as long as that contract
Yes.
is,
Yes,
Agreed upon.
this relates to new agreements as of July 1, 2025. So any existing non-compete would still be enforced.
okay, is it possible to legally make existing contracts subject to terms of this bill fall under this agreement?
That way.
As it came over from the House, it was retroactive, so it would gone back and probably eliminated all non-competes, existing non-competes.
So we took out the retroactive.
You
provision?
did not, the House struck that.
The House struck it.
There's an issue with impairment of contracts when you try to make a contract retroactive. There's an impairment of contracts issue. So I think that was why it was just prospective, not retro.
Okay, thank you.
Senator Reed.
Yeah, this has been such an interesting bill because trying to get a sense of, I think it is good we're amending it some. I guess my question is, we're singling out veterinarians, and of course they were the ones who had the most people coming to testify, but I've also, a lot of other health occupations have said this is a problem. I'm glad we're not just totally getting rid of non-competes in some ways, because I think the idea that maybe they could be applicable, we should definitely look at it closely before we just get rid of all of them. But I also wonder about singling one out. So that's where I'm trying to figure out.
I think there's a difference because veterinarians are mostly employees of for-profit veterinarians where hospitals are nonprofits. So there is some difference there.
Sure, and I think it's good on the hospital. I understand the hospital side of it. I guess other medical practices that aren't attached to a hospital though could be just as sort of, I don't want to say predatory, because when I started this, I wasn't sure it was philosophically that we should get in the middle of people's contracts, but at the same time, I recognize when you deal with it, if patients don't have access, especially, it is different. It's not just a too willing buyer type situation. So I'm just a little concerned about singling one out, but I at the same time, the vets, so they're for profit, whereas a lot of health practices, they're tied into a hospital system in some way. Is that the theory?
Not all. And there's some large health practices that aren't necessarily tied into a hospital. They may contract with a hospital. Urology firms are gotten very, very large. Anesthesiologists practices have gotten very large. Dermatology practices. So it isn't just hospitals. But there is a significant shortage of veterinarians in the state, of large animal veterinarians. And that's where we heard about was, the shortage is causing a real problem with animal care. You okay? Senator Kramer?
Thank you, Madam Chair. Did I hear correctly that there's an inflation provision? And where is that, David,
The
please?
inflation provision, if you go back to page 2 of the reprint, the middle page. That would be after line 14. This is our it's a condensed version of our standard CPI adjustment language we use in the code.
And that for me, Madam Chair, I think at this point is a serious concern. I think we set a very, very high salary figure at the 350,000. Part of this is going to be a study to look at the broader issue. I would, if I'm going to vote for this, be more comfortable if we fix it. And then we can come back after there's an opportunity to see how effective what we've done is, what the study provides. I'm just very concerned that building in this adjuster for inflation could be quickly pushing that threshold pretty high. And right now, I think the average or the median household income is around 100,000, 90-some thousand in the state. And we're setting this bar at the moment at 350,000. That's very high. I just don't know whether I'd be comfortable voting for it if we retain this inflation provision, the CPI.
I understand your concern. The reason the 350 was set was to try to include like all the nurses, nurse anesthetists, primary care, and really kind of focus on the specialists. That's why it's so high.
I understand.
But I appreciate your comments about, and you're right. I mean, we're going to do a study. I will tell you that was put in at the request of MedChi. That's why the inflation protector was put in, but.
If at some point, can I offer a motion to take out that provision?
You can do anything you like, Senator.
All right, well, at the appropriate time, would you share with me when that would be? And
Let me finish the question.
Sure.
We'll talk about that appropriate time. Senator Guile.
Yeah, thank you, Madam Chair. I, share similar concerns as Senator Kramer. I also wanted to ask, weren't we going to do something about the 10 miles, the geographic restriction? I just feel like, 10 miles is pretty low. I mean, my recollection from our last voting session was that we were going to do something on that, weren't we?
I thought that's what we decided on because there was a motion for 5 miles and that was a little low. Some have 20 miles.
Okay.
Depends on the patient. You don't want to take the access away from the patient who maybe doesn't have transportation.
Okay. Understood.
So.
Okay. All right. Thank you, Madam Chair.
Thank you. Senator Lamb.
Thank you, Madam Chair, and I appreciate the kind of work on this over the last day. I think it incorporates some of the concerns that I had, particularly with the study too, which I think was helpful. You know, a question about the 350,000 paragraph, I guess. Does the 350,000, is it just salary or is it inclusive of benefits, for example?
The word here is total compensation.
Okay, so that would
So-
include any benefits that the individual employee may be receiving.
Total annual comp, I don't think it generally, like, when I say what my salary is, it doesn't include benefits. I mean, if you wanted to add
Okay.
benefits to my salary, it'd be much higher, and I don't think we want to do, I mean, you might want to, anyway, usually just compensation does not include benefits.
Okay.
Doctors get for saving money.
Gotcha. So the way that this is defined did not include that. Okay. And, you know, I guess I would speak in favor of kind of retaining the 350. You know, we already have a healthcare workforce shortage problem. We have a specialist
Bill.
problem. You know, I think this is helpful in moving things in the right direction. I'd be hesitant to lower that just because I think it's going to exacerbate our healthcare workforce shortage problem, which could exacerbate our ED wait time problem as well as others that are out there.
So are you agreeing with Senator Kramer that we need to take out the inflation rider? Is that what you're saying?
No, I would prefer to keep the inflation
Or you
index.
prefer to keep that in? Okay. Okay, Senator Klausmeyer, you had a
Yeah,
comment?
I just want to say in my conversations with MedCog that they seem they're all right with this bill at this point. So I think it's a good balance between all players, the hospitals and.
Well, the hospital would prefer that we not do anything.
Well, yes, but that's not gonna happen here.
If everybody's unhappy, we've done a good job. Is that what you're?
That's what I'm trying to say.
So are there any other questions about the amendments that we're talking about now? So Senator Kramer, this is your time.
Thank you, Madam Chair. Yeah, again, I think the idea here was try to get some balance. And I think we have established a very high salary figure, and I understand the purpose. I get it. But I think we are looking to try to create balance, and that is the operative word. So we have established this salary figure. I think it would be appropriate and prudent to leave a fixed value and not tie it to the CPI or whatever the inflation formula will be. And let's give it a little bit of time. We're here once a year, every year. And we're in a position to take a look at whether that is an appropriate dollar amount, or if in fact it's something that may need to be increased. But I don't think I personally would be comfortable voting for the bill if we don't have a little bit more in the way of balance. And I don't think that's a huge ask. I think it's showing a little bit of appropriate prudence at this point in time. This is a very new issue we're taking up. I understand the merits for it, but I think it would be appropriate just to if we're going to move the bill without that inflation formula. So, Madam Chair, I would ask that we amend the bill to simply just strike that one provision and give this an opportunity to work.
So David, how would you refer to this motion that Senator Kramer's making that we remove?
He's removing, if you're on page 2 of the reprint, after line 14, before line 15, so it'd be, you could say paragraph 3 CPI index.
So Senator Kramer, your motion is to remove paragraph 3
Yes, ma'am.
and Senator Ellis just seconded. Okay, let's call the roll. Whatever you want.
Vice Chair Klausmeyer.
Okay.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
Yes.
Yes. Senator Ellis.
Yes.
Yes. Senator Mounts.
No.
No. Senator Washington.
Yes.
Yes. Senator Guile.
Yeah.
Yes. Senator Lamb.
No.
No. Senator Hershey.
No.
No. Madam Chair.
No.
Okay,
No.
good. So we'll take the chair's amendments will no longer have paragraph 3 in it. So it's up to you, the rest of it.
So. Can I have a motion for the bill as amended, including the amendment that we just passed? Is there a motion? Okay. Senator Mounts, are you moving or you have a question?
Good question.
Okay. Can I get a second?
Oh, yeah. Yes.
So Senator Ellis, did you move favorable?
Move favorable.
Who seconded?
Second.
We have a second, motion is second. Okay, Senator Mounts.
It's a bit of a cheeky question, but the maker of the motion that was just adopted said we'd come back every year. And that was an escalator that was supposed to take place every year. So if in this debate afterwards, everyone knows that if there is disgruntled or there is problems, they can always come back next year and per that argument for the motion that just happened. So
Senator Mounts, I was looking, the report is due January 1 of 2025. So
Okay.
we'd be coming back into session the second week in January of 2025. So
right.
we could, we would have time to put a bill in to add the escalator if that's what
Yeah.
we think we needed to do.
So that wouldn't jeopardize the negotiations that you've undertaken.
No,
No, thank you.
thank you. Any other questions, Senator Washington?
Thank you, Madam Chair. Just on the bill, when I was listening to the hearing, I did hear from the hospitals and I heard from the delegate that presented the bill. People I didn't hear from were actual doctors and I know the delegate's a doctor too, but what is their opinion? Are there doctors out there that just really want to get out of these contracts right now, that are running at the doors trying to leave Maryland? Like, what are we trying to?
Leaving Maryland's not the problem because they'd be on 10 miles. So, what we're talking about is a non-compete clause. If you leave one hospital to go to another one, if it's not at least 10 miles away, you have to wait a year.
Right.
So leaving Maryland's not the issue. I met with the representative of MedChi, which is the doctors, and that's why the amendments changed between yesterday and today was at their suggestion. They did want the COLA, the escalating clause. However, as Senator Mounts pointed out, there's plenty of time next year to do that. But no, that was a meeting. I've been meeting with the hospital and MedChi. I don't ever want to be in the middle of those two organizations again.
Got it.
It was very difficult.
Thank you.
Does that answer your question? Thank you. Any other questions before we vote on House Bill 1388? Okay, Tammy, will you call the roll?
House Bill 1388, favorable with amendment. Vice Chair Klausmeier.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
Yes.
Yes. Senator Ellis.
Yes.
Yes. Senator Mounts.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile. Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
Yeah.
Yes. Madam Chair.
Yes.
Yes.
Okay. Unanimous.
Thank you, David.
All right. Next on the list is House Bill 306, which as amended and shown in the reprint establishes the Work Group on Independent Innovation in Prince George's County. The Urban Business Innovation Initiative within TEDCO must provide staff for the work group. And by January 15, 2026, the work group must report on recommendations regarding strategies to support investments in industry opportunities and potential areas of innovation in the Prince George's County, to the Prince George's County delegation in the General Assembly. The bill terminates September 30th of 2026. The amendments make some technical changes and then specifies the unit within TEDCO that must provide staff for the work group and alters the purposes of the work group as I've described. That's shown on page 3 of the reprint. There was no opposition at the hearing. There is a delegation letter in the file.
A motion on House Bill 306. And a second,
Thanks.
Senator Kramer. So we have Senator Klausmeier and Senator. It's unanimous vote. Thank you.
The next bill on the list is House Bill 1019, which deals with petitions for emergency evaluation. As shown in the reprint, the bill clarifies that an endorsed petition for emergency evaluation is effective for 5 days after endorsement and then authorizes a court on motion by the original petitioner and for good cause shown to extend the effect of an endorsed petition by 5 days at a time for up to 30 days based on presenting behavior of the individual. Additionally, a peace officer is specifically authorized to use force in accordance with the Maryland use of force statute when executing a petition. The reprint includes an amendment by the chair that specifies that the use of force authorized is necessary and proportional. That mirrors the language that's actually used in the public safety article. And so therefore would be consistent with the provision that was in the bill as it was amended by the House.
Sorry, I was looking at the testimony on the bill. Questions on the bill? Senator Lamb?
Yeah, so I think we got an Attorney General's letter noting that when it pertains to the renewal provisions, it should follow the same, it has to follow the same probable cause standard as the initial emergency petition. Is that the case? And if we want to do this, then should we make that the standard?
I'm looking in the testimony for the, did the letter come separately than testimony?
I think it did.
I see unfavorable from the Office of the Public Defender Mental Health Division. Unfavorable from ACLU, unfavorable from the Office of Public Defender. Unfavorable from our own of Maryland. Another office.
Oh, it was I think it was an advice letter that we got from the Attorney General.
That was a separate advice
Yeah,
letter.
which we're happy to share.
Do you have that?
I do not.
Just. How does this interact with what we just passed?
Are you referring to assisted outpatient treatment?
Yes, I mean, how does, I mean,
Not directly. The
Not
AOT
directly.
bill struck provisions that were related to the emergency evaluation.
but I'm just, do we need this if we have that?
They're not
Okay, well,
related.
Move unfavorable.
Second. House Bill 1019, unfavorable. Vice Chair Klausmeier.
Yep.
Yes. Senator Kramer.
Yeah.
Yes. Senator Reedy.
Yeah.
Yes. Senator Ellis.
Yeah.
Yes. Senator Mounts.
Yeah.
Yes. Senator Washington.
No.
No. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
Yes.
Yes. Madam Chair.
Yes,
Yes.
9-1. Bill is unfavorable. What were you gonna say?
He said he fought like a tiger.
The next bill on the list is House Bill 1056, which is related to the 340B manufacturers. Would you like me to summarize the bill or you could?
No. Again?
Yes?
Yes.
Okay. So the
Summarize my amendment. I'm done with this.
So the House bill as it came over prohibits a 340B manufacturer from directly or indirectly denying, restricting, prohibiting, discriminating against, or limiting the acquisition or delivery of a 340B drug to a pharmacy on behalf of a covered entity, which is a term defined in federal law with specified exceptions. So a violation is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act and is subject to specified enforcement actions and penalties. A violation must be investigated, and the State Board of Pharmacy may impose specified disciplinary actions on a violator who holds a license or permit from the board. The bill may not be construed to be, one, less restrictive than any federal law that is applicable to a person regulated under the bill, or two, in conflict with applicable federal law and state laws and regulations. So the Prescription Drug Affordability Board is required to conduct a study on the 340B program, including the implementation and the impact of the bill. There are some amendments that are offered by Senator Klausmeier that do two things. It narrows the definition of covered entities for purposes of the bill, generally excluding hospitals unless the hospital receives certain federal grant funds. And it further narrows the scope of the bill's prohibition against limitations on pharmacies located within the state. So the provisions related to the definition of a covered entity can be found on page 3 of 5 of the reprint. And the geographic restriction is on page 4.
Okay. Senator Kramer.
A question, this was as of yesterday, I believe. Does this amendment still take out hospitals?
Yes.
Or has that, it does? Okay.
But at this point, I will withdraw the hospital. That's the first amendment. Can I withdraw that?
We didn't vote that.
You did not. This is I've represented the bill as it was yesterday. There have been no changes, nothing was adopted, but Senator Klausmeier's amendment was still offered again today.
So your amendment is not now on the bill.
I think she made a distinction between two parts of the amendment. So Senator Klausmeier, correct me if I'm wrong, Senator Klausmeier, you're suggesting removing the changes on page 3 of 5, which pertain to the definition of a covered entity, and then you would retain the change related to the geographic restriction that's on page 4.
Yeah, and the pharmacies, and I
Right,
would
to
just
be
like to
located
have
in the state.
discussion with that.
Yeah.
See,
I heard there's a problem with some of the specialty drugs are not in Maryland, so they have to come from out of state. Yeah, they're mail order specialty drugs. So if we say in state, there's going to be people that can't get their medication.
Specified specialty drugs.
Sure, yeah, I mean, I think there are two problems to highlight with restricting it to in-state only, particularly, one of them I brought up yesterday, particularly locations that are close to the borders, where you may have patients that are out of state and they're seeing clinics that are in the state in Maryland, and the closest pharmacy, that individual may actually be someone, maybe a pharmacy that's out of state. And so it would actually be less convenient to those folks that may live in West Virginia, but they're coming to a Maryland community health center. The pharmacy close to them may be out of state. That could be problematic. The other piece is the one that you just kind of cited, that for specialty drugs, these are drugs that probably are mostly oncology drugs that may need to be titrated specifically for that individual based on lab results and whatnot, that oftentimes those drugs are coming in from out of state because they're mail order drugs that are being shipped in. So restricting this to only be in-state would restrict the ability of those cancer patients to be able to get potentially out-of-state mail order specialty drugs that they might need. So I think that was my concern with restricting this to only in-state. So I would encourage restoring it back to the original form.
Senator Washington.
Shoot. Thank you, Madam Chair. I talked to Senator Lamb before this and I asked him this question, but I wanted to make sure that I asked this body and anyone else that can answer it for me. But from my understanding is that this is something that the federal government takes care of, and that's something that should be kept at the federal level. And I wonder just why we're doing it here if they already can take care of it there.
So it is from the federal government, but it obviously funds health. What are they called? The health clinics, the federal health clinics? FQHCs, as well as our hospitals.
Yep.
And so we're adding, I think, other pharmacies. So for right now, what we're doing is within the federal guidelines, but they probably are going to be issuing some additional guidelines or enforcement. I think there's been some issues, but when you look at what our hospitals do with these funds, it's amazing. I was looking at the Hopkins website and the University of Maryland, and they really do invest the savings that they have ends up income to the hospitals and is really used to help the local underserved communities. So it's kind of both. It's, you know, federal program that we do in Maryland. So Senator Lamb, you probably know more about it than I do.
Just help with the explanation to respond to the question. So the 340B program is a federal program. It's a federal program that allows the FQHCs or community health centers, which mostly support low-income folks, and any other covered entities, so like hospitals, for example, that are meeting certain requirements to serve indigent people or low-income people. Those entities would be able to contract with a drug company to be able to get reduced cost drugs for their patients. That was the program that's been longstanding. In about 2020, the drug companies have figured out that they can put in restrictions on those agreements to say, if you want to participate, if you as an FQHC want to participate with me as the pharmaceutical company, you have to go use the pharmacy that I'm telling you to use for that patient. And so it's made it less convenient for the patients to be able to access drugs that they need, particularly low-income patients, in locations that are close to them. That was a new provision, and most other drug companies now have decided to put those restrictions in place since 2020. What this bill does is set the clock back to how it was before 2020, because the federal government does not seem to be able to Congress can't step up to eliminate and put prohibitions on these types of agreements. There's not the will to be able to do that at the federal level. The Center for Medicare and Medicaid Services doesn't have the regulatory authority to be able to restrict this either. And so what that's left is for each individual state to step up to put these limitations in place, so that it says that drug companies can't restrict where patients are getting their drugs from certain pharmacies. It sets the clock back to how this program was before 2020, when the drug companies figured out that they could put these limitations in place.
Got it.
Thank you, Senator. Senator Hershey.
Thank you, Madam Chair. Senator, you were talking about not having access to certain types of cancer drugs. You were very specific in maybe specialty type drugs. Is that what we're saying? You know, so maybe, Madam Chair, we could look at just not allow, or, you know, excluding specialty type drugs. I still think we should put some type of a, if you don't want to say in state, if you think that's too restrictive, then we could say, you know, we just talked about, you know, a certain mile radius of things. But, you know, when most of these are using out of state pharmacy, it's certainly also hurting our small pharmacies as well too. So, you know, they're not the ones that are probably providing the drugs that you're speaking about anyways, but I'm assuming that they could be providing some of these other drugs, and maybe we can somehow say that this should be for specialty type drugs. Either way, I, you know, agree with my colleague at the end here. You know, this is a federal program. I know, but this is a federal program, and just the fact that Congress has been working on it for so long and can't come to an agreement, but yet in our, you know, 90-day session, we're going to figure this out. You know, I just don't, I think that there are, I mean, I'm sure everybody's been getting the same amount of texts and emails and stopped by the offices as I have on this. And it's because we don't have this figured out. If we did have it figured out, you know, we wouldn't see all this, because they'd all be leaving us alone right now. But we haven't figured this out. And I don't think this bill, the way that it is, no matter what we amend, is going to figure this out yet.
Senator, the one thing that the bill does do differently is allows our smaller pharmacies to be part of the program. And that's what we've heard from them for years, that they're really struggling. And this would allow for additional business income for our small pharmacies, which we haven't done anything this year to help them. Senator Lamb.
To that point, I think Epic Pharmacies has a letter in the bill folder saying they support this. It does help the local pharmacies. I think the specialty drug piece is only a small portion of the drugs that we're talking about, but it points to the fact that I don't think we want to limit it to just in-state. So there's concerns with people that are cancer patients being able to get their drugs by mail order from out of state. Even if you were to draw a mile radius, you don't know where they're being mail ordered from. There are other examples of people that I gave earlier, people living just across the border and some of the edges of the state that may be coming in to use our federally qualified health centers. There's also the example yesterday from if it's a college student, for example, family lives here, they may be going to a federally qualified health center because they're low income, but they go to college just out of state in, say, Delaware. Those folks would also have a hard time being able to get their medications. There is also a study at the end of this bill that will be able to give us some more information if it needs to be refined later. You know, that's something that can be looked at, but I think keeping it as originally as it came over from the House without the geographic limitations important for kind of all those reasons.
Thank you, Senator. Senator Glassmeyer?
Yeah, I just have a question for Senator Lamb. If I go to one of the FQUAs, if that's where my doctor is, do I have to go to a particular pharmacy? Now, I know we've been going back and forth, just yes or no.
Yeah, so these FQHCs are, for example, healthcare for the homeless. This is an FQHC.
Okay,
right?
so if
for-
that's where I go to get my health care, do I have to go to a particular pharmacy?
So
At this time?
under the program as it originally was conceived, the healthcare for the homeless would say, okay, which pharmacy is closest to you? You would be able to select that pharmacy to get your medication from. What has happened since 2020 is that the drug companies have told healthcare for the homeless, just to use an example, that you can only tell you as a patient to go to that particular pharmacy. That might not be closest to you, but because of the agreement that healthcare for the homeless has with the drug company, you're being told you have to go to that pharmacy. You don't have a choice. And so what this bill does is it tells the federally qualified health centers that you cannot have those limitations in place with the drug company, that you as a patient will have the freedom to be able to select the pharmacy that's actually closest to you to be able to go get your medications.
Okay, so
It prohibits.
that's where I could go right down the street rather than on the other side. of
Right, you
town.
would have choice of the
And
pharmacy that you want.
That's what this bill does,
Yes,
without
it
any
restores it
amendments or
back to that status quo. That's how the program was originally conceived.
anything.
And
But I want to know that this bill is how the program originally started.
this is a federal program.
Yes, yes.
And this bill will restore it back to the intentions of how the original federal program was implemented.
And we can do that.
We can do that because the federal government can't seem to do that. And to Senator Hershey's point, there have been other states that have done this before too. We are not the first state to put these restrictions in place to make it easier for patients to get their medications at pharmacies close to them. The other states that have done that, I think there's like 8 or 9 of them. They include places like Louisiana and Arkansas.
Okay.
Senator Reedy?
Can I ask a question or can I make maybe a comment? My understanding though is that a lot of our hospitals have contracts with pharmacies already. And that like I got some stats that said there's like 894 contracts between Maryland's 340B hospitals and nationwide pharmacies. So we keep talking about the drug companies forcing people to go use other pharmacies, but most of the covered entities in the state have contracts with pharmacies. So I'm a little confused as this is what I keep like looking at all the different things we're getting and just trying to understand. I echo what Senator Hershey says. I kind of feel like we ought to. This is not like an ideological thing. I mean, I just feel like we're making a big shift here or change when we maybe should take a little more time to think about it. But so is that the case that what am I missing when I find that they have contracts, hospitals and other care providers, maybe like a healthcare for the homeless, although I don't know if they do, but do they have contracts with pharmacies to provide drugs? Or am I mixing apples and oranges?
Senator Lamb, do you have a knowledge of that?
I think the contracts that these agreements that they have to enter in with are with the drug companies, which is why the drug companies are able to put a stipulation to say, we're going to provide this medication to your patient, but we're going to send this medication to that pharmacy. And your patient, if you're the community health center, your patient has to go to that pharmacy to be able to get their medication.
If the patient goes to any pharmacy, do they know that there's a savings? The savings doesn't get passed to the patient, right? For
No,
any
the
pharmacy.
savings gets put back into the community health center for them to reinvest in the community.
But we don't know for sure. We know the hospitals, I got a report back from LifeBridge and I appreciate them sending it to me. They didn't send me the statistics, but they sent me extensively what they do reinvest on, and it all sounds great. But apparently there's nationwide, they're only auditing like 1.5% of contracts of these contract federally. So I don't know that I feel like I keep mixing up apples and oranges. I mean, I'm really asking, what am I missing?
So yes, you've seen some of the reports, for example, from LifeBridge. The chair mentioned that she's seen reports from Hopkins and and the requirement is for the dollars that are saved to be reinvested by that community health center back into the community that they're serving. There is, in the back of this bill, the House added a study so that we can really double check and examine and make sure that those dollars are actually getting put back into the communities that they're serving. And at the federal level, there are regulations in place allowing the federal agency HRSA, the Health Resource Service Administration, to audit any contracts and audit any of the spending related to the 340B program. It also allows drug manufacturers, to also audit any of the 340B contracts that they're going into with these community health centers. And if there's any issue there, those audits could be requested upon on demand, and that could highlight any issue as well.
The commentary here about the small pharmacies, and I do see Epic had supported it, but I mean, this bill isn't going to do anything to stop PBMs from forcing people to go to other pharmacies. I mean, if we wanted to help the small pharmacies, we would take action on
That's a
PBM
different bill.
legislation. Well, yeah, but if we keep talking, we keep talking about the evil pharmaceutical companies, and they're an easy bogeyman that they're pushing people to different pharmacies. But we literally have a 800-pound gorillas that push people to pharmacies every day. It doesn't seem to merit. I mean, I just don't think we should say we're doing the small pharmacies a huge favor by passing this bill, in my opinion. But it just feels like a big shift to do this without more information.
Can I share something while we're just chatting? John Hopkins, the fiscal year 22 saved $211 million under this program, and then spent $321 million investing in the community. This is big dollars.
But this bill isn't going to. We don't need this bill for them. Oh,
Well, we can't have the amendment that, I'm sorry, that my vice chair is offering. I mean, because that would take out the hospital. Yeah. But I mean, it is significant. And so we've got the small pharmacies, Epic, asking for the bill. The hospitals want to keep the bill. We've got the FQHCs that want the bill. What's it, the Ryan White
Yes.
health centers want the bill. Yeah.
Do we have to specify in the bill that all pharmacies, the chains and the independents, should be included in the pharmaceutical group?
It's in the bill as amended in the House.
That's in.
It's
okay.
already in the House.
Well,
version.
I withdraw my amendment and let's just get the show on the road.
In its entirety. We no longer have a Vice Chair Klausmeyer's amendment. Senator Mounts.
Yeah, Madam Chair, I feel obligated just to comment for my small pharmacies, but this bill for them is not a priority. For the small pharmacies is not a priority. In fact, they've got some issues. I do have a federally qualified health center. It is a priority for them. I just wanted to clarify that.
Because we're all representing our own districts. Senator Hershey.
Thank you, Madam Chair. I'm sure everybody got something from Public Policy Partners. I just want to read some of this real quick. Yesterday in finance voting session, there were a ton of questions on what the federal government is doing on reforming 340B, as well as the program's intent and questions on the program accountability. I wanted to make sure the senators knew the federal government is working hard to reform the 340B program on the national level with the goal to pass bipartisan legislation before the end of the 118th Congress with meaningful reforms to address the nuanced concerns of the federal program overall. And at the very end, it says, these important efforts are being led by our own U.S. Senator Ben Cardin. So, Madam Chair, I'd like to offer an amendment that simply takes and delays the implementation of the first section of this bill for 1 year. So we would still have everything the way that the bill is written, no amendments from the vice chair, delays it for 1 year, allows the study to take place that we have at the bottom of the bill, and allows our good friend Ben, Senator Cardin, to see if he can help lead bipartisan efforts to create the reform that's necessary at the federal level. I think that would be the more prudent way to go about this program. The program will continue the way that it's been going on forever. Johns Hopkins will still be doing wonderful things, but we will not be passing policy that very few of us, I would imagine, fully understand, and, you know, potentially doing something that hasn't been well thought out for a federal program. I think it's a simple amendment to just simply delay implementation of the section 1 of this for 1 year, put the study in place, and let's talk about it next year.
Senator Lamb.
So we have been corresponding with Senator Cardin's office this morning, and we have an updated email from Senator Cardin. This is from Martha Kramer in his office, and it says in part, and quoting out of this, Senator Cardin generally does not interfere with issues that are firmly within the purview of the state legislature, that this is an issue that is in the purview of the state legislature.
That's saying, or you're looking for his opinion on this piece of legislation. It's not saying whether or not he's down in Washington, DC, working hard on trying to resolve reform. They just said, don't ask us for an opinion from him on what you guys should do.
But he believes that this is firmly in the purview of the state legislature. If the federal government is not stepping up to reinstate the program as it was before 2020, then the states can, and other states have.
Makes it
Louisiana
sound
and
like
Arkansas.
he's not confident in his efforts to do something. That's what it sounds like.
Do we ever have any confidence in what Congress can do?
Not yet.
Yeah, thank you, Madam Chair. I just want to say that, I have confidence that the U.S. Senate can take action, get things done, but that House of Representatives, it seems like it's a constant case of chaos. And so I wouldn't want to delay anything based on the U.S. House of Representatives getting together and getting things done. So, yeah, thank you, Madam Chair.
Thank you, Senator. Senator Kramer.
Madam Chair, I would just share a sentiment very similar to that of the good Senator Ellis, that when you're talking about what's happening on Capitol Hill, glacier speed at best would describe what's going on there. And the prospect of anything productive, I think, is wishful thinking. So I don't know whether there's a motion in a second, but certainly I would ask that we resist the amendment, move the bill as it is before us, and thank you.
So that's your motion to move the bill.
I offered the amendment.
What amendment?
To delay the implementation date of section 1 by 1 year.
Okay, so
I had a question about that and we went on. So if we pass the bill and then the federal government comes in and they would then override us, right? The federal government preempts the state. So we don't, all we're trying to do is go back to the 2020, the way it operated in 2020 until the federal government makes up their mind.
Maybe that's what they decide.
Then why is Senator Hershey's amendment necessary then? That's what essentially you're saying is as if the federal government does act and ultimately
we have a
preempt.
motion in a second.
Well,
Can
we have-
actually vote it.
Wait a minute. Well, Senator Hershey did create a motion. We didn't make it formal, but let's vote his motion.
Correct.
Okay.
The point is.
Let's
quickly kill it and then we can.
Senator Kramer, behave. Please. Please. Okay, so Senator Hershey, let's hear your motion.
My motion again is very simple, that it would delay the implementation of section 1, which is the bulk of the bill, right? By 1 year. Which would make that July 1st, 2025. It would allow the study to go forward, which we have asked for.
Mhm.
If Congress does something by the end of the 118th Congress, which I would assume is at the end of this year or beginning, I mean, that's the Congress that's going on because it's an election year. We would come back in January and we would see what Congress has done.
Okay. So do you have a second for your motion?
Justin did.
Justin second. So we have a motion and a second. Senator Lamb, you want to discuss that?
Yeah, I would just urge that we reject this amendment with all due respect. I think, there are millions of dollars at stake here. Even the chair just pointed out over $200-300 million at stake here.
I don't want this amendment. So we're going to take a roll call on the amendment. Tammy?
Does that mean that?
Vice Chair Klausmeyer.
No.
No.
We're
Senator
taking a
Kramer.
vote, Senator Hershey.
No.
No. Senator Haight, Senator Reedy.
Explaining my vote is yes, and we're not putting money at stake by delaying for a year. That I don't believe that is accurate based on everything I've heard. There's a huge like moving controversy at the federal level. No one's going to lose money if we don't enact a state law right now that goes into effect in July. So my vote is yes. Let's give it some time.
Small pharmacies will lose money.
Senator Ellis.
No.
No. Senator Mounts. Yes. Senator Washington.
No.
No. Senator Guile.
No.
No. Senator Lamb.
No.
No. Senator Hershey.
Amazing that I'm the one that has confidence in Senator Ben Carson.
Pardon.
He was here and I know we did that. Right, sir. Yes.
Yes.
Yes. Madam Chair.
No. Okay. Senator Kramer, you had a motion?
Now you like.
Favorable as it came from the House. And we have a second with Senator Ellis. Can we take roll on House Bill 1056 with the amendments that came from the House?
House Bill 1056 favorable with amendment.
It's
Vice Chair.
favorable because the amendments were applied in the House. Yeah.
House Bill 1056 favorable. Vice Chair Klausmeyer.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mounts.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
No.
No. Madam Chair.
Yes.
Yes.
7-3.
8-2.
Oh, 8-2, bill passes.
Next bill is the cross file, Senate Bill 986. Motion favorable with amendments would conform the Senate bill to the House bill as the committee just voted.
Same, with the same vote.
With the same vote. Should we vote it again? Okay, same vote as we did on House Bill 10, except now it's favorable with amendment.
Correct.
Okay. All right, so now we're going to do the last bill of the day. House
Beyond
Bill.
that, there are actually,
Pardon me?
there's.
Oh, that's where we
more.
added one.
Yep.
We're not
But-
doing the last bill of the day. Next to the last bill of the day is House Bill 1203.
House Bill 1203 establishes the Strategic Infrastructure Revolving Loan Program and Fund within the Maryland Economic Development Corporation, or MEDCO, to make loans for targeted investments in real estate and infrastructure projects to support specified economic, community development, inclusion, and equity objectives. MEDCO may set the terms and conditions for loans made under the program. The bill does not mandate funding, nor does it specify an intended level of discretionary funding. The bill also allows MEDCO with local approval to pledge specified alternative revenue under the Tax Increment Financing Act. And so pledged funds may be used for specified purposes, including to support strategic infrastructure, to support the Strategic Infrastructure Revolving Loan Fund. So MEDCO must adopt implementing regulations. There are no amendments.
I have a question that came from someone. Would this include like the redevelopment of Crownsville State Hospital.
That would be an authorized use. I'm not aware of the particulars of the Crownsville redevelopment project to be
Okay.
able to answer that specifically. I would have to look into that.
That's fine. Someone asked the question and I didn't know the answer. Yep. Okay. Do we have any other questions on House Bill 1203? Senator,
Madam Chair.
yes, Senator
Yeah,
Ellis.
so, Nathan, there's a fiscal note of, like $20 million in out years with this. So where does that money, come from? Is it the
So
revenue
the-
expenditure?
I'll explain the context here is that the bill does not establish any mandated funding, nor does it specify an intended level of discretionary funding. In this case, the department, in analyzing the bill, determined that $15 to $20 million would be the appropriate funding of the program in order to achieve that program's goals. So if you recall in the hearing on the House bill, Senator Hayes asked the question directly to Medco about whether there is any money lined up for this, or would there need to be in order to essentially kick off the program. And the answer was that there is no funding right now, and that money would be required in order to kick off the program. So I would characterize the fiscal note as an illustrative example of the type of funding necessary in order to implement the bill as it's intended.
Yeah, thank you for that. So, is it one of those, the governor may include in the
Yes.
budget this base amount? Okay, great. Thank you.
Thank you for that question, Senator Ellis. Any other questions for House Bill 1203? Thank you, Senator Washington and Senator Klausmeyer seconds. All in favor of House Bill 1203? It's a unanimous vote. Thank you.
Okay, next, the chair has asked the committee to consider a House Bill 499. This is the bill related to private dental offices and infection control. The Finance Committee has in its possession also the cross-file Senate Bill 335, a reprint of which, reflecting the amendments that were applied in the House, is in your packet. Yes, the Senate bill reprint is in your packet, and that would be identical to House Bill 499 that I'll describe now. And so House Bill 499 requires each owner of a private dental office to designate a licensed dentist to be the supervising dentist for the office. A supervising dentist must complete the registration required by the State Board of Dental Examiners and be responsible for all infection control activities within the office as specified in the bill. If a supervising dentist relinquishes their responsibility for infection control activities, the owner of the private dental office must immediately designate an interim supervising dentist until a new supervising dentist registers with the board. So the House amendments define infection control activities, remove language that would have limited the number of private dental offices that a supervising dentist may supervise. And further, the House amendments clarifies that the requirements of the bill do not fall under the definition of practice dentistry or limit the availability of an unlicensed person to assist in regulatory compliance requirements. So the House bill before the committee has, and so that clarifies that the requirements of the bill do not fall under the definition of practice dentistry or limit the ability of an unlicensed person to assist with regulatory compliance requirements. So for the House bill, there are no additional amendments, and it would be a motion favorable. The Senate bill would require amendments to conform.
Was there opposition in the Senate?
There was, but there were. So move favorable.
Do I have a second?
No, second.
Senator Giles, second. Okay, all in favor of Senate Bill 335 to keep our dental offices
House Bill
clean?
499 is
Sorry, House Bill 499.
favorable, yeah.
Favorable, okay.
And then next would be Senate Bill 335, favorable with amendments conforming to the House bill.
Do I have a motion
Move favorable.
and a second, Senator Ellis? All in favor of conforming Senate Bill 335? Unanimous vote, thank you.
So